Well, according to my clock in Waterloo, it is now 1 o'clock. So it might be slightly different in your location, but we do have a full hour. So I'm just going to start the webinar, and then those who are coming in slightly after one, of course, will join us. So first of all, from the KDE Hub, a very warm welcome. We are so glad that you could join us today, and this is going to be a fabulous presentation on a really incredible study by our guest speaker and his colleagues. For those of you who don't know me, my name is Colleen McMillan, and I share the position of co-director with my colleague, Alice Schmidt-Hambich. Hi, Alice. And of course, we are here at the KDE Hub at Renison University College, University of Waterloo. So a couple of things that won't be new to you if you joined our webinars in the past. Number one, we are recording the webinar, which I believe you gave consent to as you entered the room. And number two, we will be sharing an event brief after the webinar, so you can again fully engage with the content that our guest speaker will be sharing. If you have any questions at all during the webinar, please put them into the chat box, and the chat box will be monitored by Mary Alice at the KDE Hub. So we'll make sure that we get all of those questions or comments addressed as we go along. Right now, my colleague Annetta is going to pop a poll in the chat. And she's going to be doing that just momentarily. And if you could do the poll now, it's very, very short. And then at the end, it's really just to kind of gauge your knowledge on the impacts of nature on children and mental youth. So if you could, just one question. When I said really short, I meant it. So if you could just do the poll now, and then we're going to do it at the end of the webinar. Thank you, and our thanks in advance. So for those of you who have joined the KDE events in the past, you know that we do start with a land acknowledgement. And today we would like to start with a bit of a different kind of land acknowledgement, knowing that many of you have joined us right across Canada and that you represent many different treaties on which you work, learn, live, and play. And we want to be mindful of all of those treaties. The Hub's intention, we try to create a very welcoming and inclusive environment to ensure that all people, places, treaties are visible. And that we at the Hub, as I'm sure you are in your organizations, are actively working against colonialism and toward cultural safety, inclusiveness, and of course, reconciliation. One way to do this is by acknowledging the Indigenous peoples of all the lands right across the country that we are on today. And while we're meeting, of course, on a virtual platform, I'd like us all to take a moment just to recognize the significance of the lands that we reside on. And from coast to coast to coast, we acknowledge the ancestral and unceded territory of all Inuit, Métis, and First Nations people that call this land home. So I'm welcoming you on behalf of the Hub to join me in a moment of reflection, to also acknowledge the harms and the mistakes of the past, but also that's currently ongoing in the present, and to consider how each one of us can, in our own way, work toward a spirit of reconciliation and collaboration. As you know, this coming Monday is Truth and Reconciliation Day, a federally recognized day for us to do a couple of things, to pause, to reflect, and to start to make, and I think this is the important word, meaningful amendments toward the intergenerational harm that was done to residential school survivors, their families, but also their communities. And it's a space for us to recognize and commemorate the legacy of residential schools, and whether this takes a moment of quiet reflection, gaining a deeper knowledge in your own way, or maybe up the spectrum of participating or taking action in your specific location, would be a step toward this goal. So again, on behalf of the Hub, we invite each and every one of you to determine what way you'd like to mark this day. So it's now my pleasure to hand over our time to Shannon Bradley Dexter from the Public Health Agency of Canada, or PHAC, who I know you know Shannon, but you may not know she recently joined the Mental Health Promotion Policy Unit. So congratulations, Shannon. That's a wonderful move, and they're going to greatly benefit from your involvement there. Shannon introduced the KDE Hub to the SCAN study of children accessing nature study, and to Dr. Daniel. And I had the good fortune of serving on the advisory committee, and it was a tremendous committee to serve on, and the findings are so significant. I'm really looking forward to hearing them again and introducing you to the findings of the SCAN study. So on that note, I will hand over our shared space to Shannon.
Great, thank you, Colleen. And welcome, everyone. Thank you for joining us today. Thank you, Colleen, for the meaningful land introduction the land acknowledgement that you provided, and that space for reflection. We really appreciate the KDE Hub hosting this webinar today. We are really excited to share the results of this study on children accessing nature. This represents the first time that we have Canadian data on this subject. And this project began about a year and a half ago as a collaboration between the Public Health Agency of Canada's Behavioral Science Office and the Mental Health Promotion Innovation Fund. We also developed an advisory committee who helped inform this work. As a starting point, we knew that time spent in nature was connected to improved mental health and well-being for children and youth. And we wanted to better understand the current context in Canada from a health equity perspective. What are the barriers to accessing nature, and what are the opportunities? It was a pleasure to work with Daniel Almeida on this project. Daniel designed and conducted the study, and he's going to present his findings. I am pleased to introduce Daniel. He has a PhD in neuroscience and behavioral epigenetics, specifically focused on the long-term impacts of child abuse on the human brain. Currently, he's a behavior science fellow, working with the Privy Council's Office with Impact and Innovation Unit in Health Canada, focused on cannabis use in young children. The specific research interests are connected to how both positive and negative early life experiences shape the developing brain. So this is really helpful context for the study for children accessing nature. So thank you, Daniel. Over to you.
Okay, so hopefully everyone can see my screen. Can I just get a quick check there? Wonderful, great, thank you so much. So I want to start off by really thanking Colleen and Shannon for the wonderful introduction, the KDE Hub really for their generous invitation to present our work today, and all of the attendees here for taking the time out of their schedule to learn a little bit more about children's access to nature. So I want to acknowledge that the work presented today is a result of a collaboration with the wonderful folks at PHAC's Mental Health Promotion Innovation Fund, and was supported by an advisory committee composed of members from PHAC's BSIO, or Behavioral Science Office, PCO's Impact Canada, the KDE Hub, and PHAC's Mental Health Promotion Unit, Centre for Surveillance and Applied Research, and Aboriginal Head Start Program. So while I'm the one presenting, there are a lot of people that contributed to this project, and I just wanted to acknowledge that. A final note that we'll be having a Q&A period at the end of the presentation, so feel free to put your questions in the chat box, and I'm happy to get to them once we get to that point in the presentation. Okay, so without further ado, I'll go ahead and talk about our study on children accessing nature using behavioral science to understand the barriers and drivers underlying children and youth's access to nature. So looking at our agenda for today's talk, we'll first start off by diving into the background and methods for the study. We'll then move into the results that we generated to address 3 of our major research objectives, followed by a discussion of potential strategies for increasing children and youth's exposure to nature. Right, so we'll start off with our backgrounds and methods now. So when looking at the literature, we observe that connecting children and youth with nature has been shown to promote a whole bunch of positive outcomes, including creativity, pro-social behaviors, emotional well-being, and really just overall resilience and mental well-being. Interestingly, childhood experiences in nature are also associated with positive perceptions of nature and pro-environmental behaviors later on in life. Now, despite these benefits, there's been a marked decline in children and youth's overall exposure to nature and really more generally the outdoors over time. And so in response to this trend, the term nature deficit disorder has emerged to really describe the consequences of human alienation from nature, especially for children and youth. Now, there are several social and technological factors that might be responsible for this decline. They include urbanization and other structural barriers, overscheduling, and really the proliferation of digital media and technology. So if we want to identify effective strategies for increasing children and youth's access to nature, we really need a clear picture of the drivers and barriers. Now, if we think about children and youth specifically, their access is strongly influenced by their parents. And so learning from parents is one way to really get a comprehensive picture of some of those drivers and barriers. And though previous studies have provided rich details on these barriers, their limited sample sizes, really specific community focus, and use of non-Canadian samples can limit the generalizability of their findings. What we did observe in the literature was that there's this awareness action gap where parents perceive the benefits of their children spending time in nature, but are not regularly engaging it as a part of their child's healthy development. And so these findings really highlight the importance of a behavioral science-based approach. Behavioral scientists love addressing kind of gaps like this. And so aiming to identify effective strategies for increasing children and youth's access to nature as a way to promote positive mental health, BCIO and Impact Canada partnered with the Mental Health Promotion Innovation Fund to design the Study on Children Accessing Nature, or SCAN. Now, we had 3 primary objectives. They were to advance our understanding of the effects of exposure to nature on child and youth mental health, to characterize differential exposure across sociodemographic groups, and really to identify drivers and barriers underlying children and youth's exposure to nature. And the hope was that these results would be useful to our project partners, which is the Mental Health Promotion Innovation Fund. Now, a quick summary of our research methodology. The data was collected between December 2023 and February 2024. We had a large sample of 2,998 parents who were above the age of 18 years old and lived in Canada. I'll also say that a parent who participated reporting on one of their children, the other parent or other parents were not able to participate as well. So that was an exclusion criteria. Now I'll say that respondents were recruited from Qualtrics panels with quotas to really allow for a comparable demographic distribution in the sample as what was reported in the 2021 census. But I will say that while the sample is meant to be representative, it's a non-probabilistic sample, and so comparisons to the general public should be made with caution. And these are some of the variables that we used for our quotas. And I'll just say a final note that given that this work didn't employ any specific type of experimental design, such as randomized controlled trials, the findings represent correlations and not necessarily causal relationships. All right, so now that we've covered the background, let's go ahead and jump into the results. As I mentioned previously, there were 3 main objectives for this work. And so what we'll do now is we'll look at the results corresponding to each of the individual objectives and start off with objective 1, which was really to advance our understanding of the effects of exposure to nature on child and youth mental health. So we wanted to start off really by characterizing just children and youth's access to nature in general. And specifically, we wanted to characterize differences between the warmer and colder months of the year. Now, when you think about the term green spaces, you probably think, there's probably quite a bit of variation in what people consider to be green spaces. And so to get around that, we really created this operationalized definition where parents had to respond to specific types of green spaces that are listed here on the right-hand side. So everything from community gardens to creeks and wetlands to woods, forests, and even community parks surrounded by trees. And so when looking at frequency, so the top graph, you'll notice that children visited green spaces more frequently during the warmer months than during the colder months, and also spent more time per week in green spaces during the warmer months and colder months. And certainly we have to consider the effect that summer break has here, but we are seeing that children spend more time, of course, in green spaces during the warmer months. The types of spaces that children visit also varies. So you'll notice that across the board, children visited each of these different types of green spaces more often during the warmer months. And also the average number of green spaces they visited also was less during the colder months and more during the warmer months. So what we're seeing is that children are spending less time in green spaces and visiting a smaller kind of diversity of green spaces during the colder months compared to the warmer months. So you'll remember that I mentioned early on when going through the background that there's been this sort of declining trend in children's access to nature over time. And though we didn't employ a longitudinal strategy where we could sort of track that, one way that we wanted to tap into this question was really ask parents, when you were your child's age, how frequently did you visit green spaces? And just looking at the highest frequency category here for the warmer months, you'll notice that 11% of parents reported that their children visited green spaces 4 or more times a week. But this is in comparison to parents reporting that when they were children, 50% of them reported that they visited green spaces 4 or more times a week. So there is quite a big difference there that we're observing. And certainly we do have to take into account recall bias that parents are reporting on their exposure, which happened decades later, or decades earlier rather, and they're reporting decades later at some times. However, these differences are still quite large. So now thinking about the relationship between exposure to nature and child and youth well-being, we use what's known as the Strengths and Difficulties Questionnaire, which is a 25-item emotional and behavioral screening questionnaire designed specifically for children and youth. This questionnaire is composed of 5 subskills, including 4 subskills that make up what's known as the total difficulty score. And the final subscale measures pro-social behavior. And in this case, pro-social behavior refers to voluntary actions really intended to benefit others, society, and can include behaviors such as helping, sharing, donating, cooperating, and even volunteering. Importantly, the literature has shown that pro-social behavior in children and youth can foster empathy, enhance social skills, strengthen relationships, and even promote a sense of community and belonging. So we thus focused a lot of our analyses on this sort of pro-social behavior outcome. A final note that the psychometric properties of the parent-reported SDQ has been validated in a nationally representative sample of Canadian children, really making it ideal for our particular purposes. Now, interestingly, just sort of comparing baseline without bringing in green space just yet, pro-social behavior scores were lower for youth compared to children, boys compared to girls, and then children and youth with a disability compared to those without a disability. All right, so what we wanted to do is we wanted to really take frequency of visits to green spaces and see when do we start seeing sort of a significant relationship with pro-social behavior. And what you can see is that at twice a week or more, we begin to see an association with increased pro-social behavior. So each of the boxes here that are highlighted in green represent significant kind of associations with pro-social behavior. Now, if we think about the frequency of children and youth that were meeting this level of exposure during the warmer months, only 42% of children and youth actually met that sort of 2 times a week or more of visits to green spaces. And this was actually a lot less during the colder months, where 19% of children and youth met this sort of definition of 2 times a week or more, where we're starting to see that kind of association with pro-social behavior. Now, if we think about some of the child-related variables, a smaller percentage of youth met this kind of exposure level of 2 times a week or more, girls, and then also children and youth with a disability. And you'll notice that youth and children and youth with a disability will come up again in a couple more of our analyses. So what we then wanted to do was we wanted to make sure that our results really mapped on to a general mental health measure that's typically employed in surveys done by FAC. This was just to make sure that that 2 times a week or more could be kind of validated in this using another kind of question. And so what we did was we looked at the percentage of children and youth in our sample classified as having high general mental health. And the way that we kind of come to that is parents who selected very good or excellent for the question, in general, how is your child's mental health? And what you'll notice is if you look at the graph on the right-hand side, children and youth who visited green spaces less than 2 times a week or more, 62% of them were classified as having high general mental health, whereas children and youth who visited 2 times or more per week, 70% of them were classified as having high general mental health. And while an 8% difference doesn't seem large, if we think about 8% of our sample or even 8% of Canadian children and youth, those are pretty large numbers that are starting to emerge. All right, so now that we've taken a look at objective 1, let's take a look at objective 2, which was really to characterize differential exposure across different sociodemographic groups. And before I do that, I just want to tell you a little bit about the literature surrounding this research objective. So what we know from the literature is that individuals belonging to marginalized communities often face structural barriers such as physical proximity to natural spaces, and even financial constraints and limitations on time. Cultural barriers also play a role, with some communities just believing that nature isn't for them. Now, interestingly enough, contact with nature actually might be particularly beneficial for disadvantaged populations. So if we look at the image on the right-hand side, this is from a previously published report in 2008. And you'll notice the 3 different pastel colors here. Each of those represent income groups, pink being the lowest income group, gray being the highest income group. And along the x-axis, you'll see exposure to green space, so kind of level of exposure. And in the lowest level of exposure, there are quite significant differences between income groups for deaths for circulatory diseases and then all-cause mortality. But as you start to increase green space, exposure to green space, those differences actually start to disappear, and basically we see more of this equalization occurring. And so what the authors of this paper really suggested was that what nature might help to do is attenuate some of the toxic effects that come from various kind of social factors. So we tested a variety of specific sociodemographic predictors. Each of these predictors are of the parent and not of the child. So the parent reporting kind of on their own kind of variables here. So each of the ones on the screen here are ones that we tested. So thinking about region to start off with, we saw that a smaller proportion of children and youth in Quebec visited green spaces twice a week or more compared to those in British Columbia. Now, none of the other tests were significant. None of the other differences were significant between provinces. And I will say that while for the territories, we see 67% of children and youth meeting that definition of twice a week or more. These data were really based off of a sample size of six participants, which means that we should really cautiously interpret those specific findings. All right, so looking at the sociodemographic variables that came up as significant, children and youth visited green spaces less frequently if their parents were first-generation Canadians compared to second-generation or even third-generation Canadians, if their parents identified as a visible minority versus not, and if their parents had a household income of under $150,000, or spoke a language other than English at home. All of those kind of variables showed us kind of differences in exposure to nature. Now, the proportion of children and youth who visited green spaces twice a week or more didn't vary by these other sociodemographic variables here. And one thing that I'll just say, a bit of a caveat, when we think about Indigenous heritage, this work really looked at recreational connection to nature and recreational access to nature, as opposed to cultural connection to nature. And so we just need to be sure that we interpret these results again with caution, and that further research is used to kind of follow up on different aspects of kind of connecting to nature. All right, so moving on to our last objective, which was really the drivers and barriers underlying children and youth's exposure to nature. We really wanted to identify some of those barriers to hopefully identify strategies for addressing them. So you'll remember early on in the talk, I mentioned that parents play a really important role in their child's access to nature. And so we first wanted to start off just by looking at parents' connection to nature, right? Do parents in general feel connected to nature? And maybe does that potentially play a role in their child's access? And so to do this, we administered the Nature Connection Index. And you'll notice that most parents are agreeing with these statements related to kind of treating nature with respect and finding beauty in nature, or finding nature really amazing. But what you will see on the graph on the right-hand side was when we sort of disaggregate our data into parents of children who visited less than 2 times a week versus those who visited 2 times a week or more, you'll notice that parents of children who visited 2 times a week or more had significantly higher kind of nature connection index scores. And this suggests that maybe connection to nature, parents' connection to nature, is playing somewhat of a role in children's access as well. So interestingly enough, you'll remember we also asked parents, when you were your child's age, how frequently did you visit green spaces? And what we did was we wanted to kind of associate that with their connection to nature today. And what we found was that, again, twice a week or more, so parents who visited green spaces twice a week or more, we found this association with increased connection to nature later on in life as adults. So it's interesting that we're seeing this kind of twice a week or more as being beneficial for, or associating with higher pro-social behavior for the children and youth, but then also increased connection to nature for the parents. Again, important to kind of remember that parents are reporting on their exposure that happened sort of decades earlier, but nonetheless an interesting finding. So we then asked parents a whole bunch of kind of statements related to their perceptions of the effects of nature on their child. And I was really pleasantly surprised when I saw that all of the positive perceptions were more highly agreed with than the negative perceptions. So you'll notice that all of those in green are kind of positive statements, such as playing in nature is good for my child's health, or my child's learning can be stimulated by playing in nature. And for negative statements, you'll see that, the one that was endorsed the most, which was only at a frequency of 23%, was that my child gets too dirty while playing in nature. And so what this really shows us is that parents kind of can see the benefits of exposing their children to nature in general. In fact, 92% of parents reported that, or agreed and endorsed the statement that playing in nature is good for their child's health. So that was a good thing to see. So then we kind of move to kind of the next question of, if parents perceive the beneficial effects of exposing their children to nature, then why aren't children sort of spending a large amount of time or visiting green spaces as frequently as we would expect? One of the pieces that we observed in the literature was that screen time might play a significant role in the amount of time that children spend outdoors, and then of course in green spaces. And what we found was we set this sort of definition of 2 hours or more per day of their free time with electronic devices. And what we found was that actually 56% of children and youth were spending 2 hours or more per day during their free time. So that doesn't include, doing homework or while at school. And this number was even higher during the colder months, which was 67% of children and youth were spending more than 2 hours per day with electronic devices. Now, when we think about the effects of that time with electronic devices, you'll notice that 2 hours or more per day, we start to see associations with increased sort of mental health difficulties. You'll remember earlier on, we talked about the total difficulty score, and that was a composite of sort of 4 subscales, and that's how we're kind of measuring mental health difficulties here. But we are seeing that kind of association with increasing mental health difficulties with increasing screen time. And I'll just say that a larger percentage of youth and children and youth with a disability spent 2 hours or more per day with electronic devices. You'll also remember that earlier on, we mentioned that a smaller percentage of youth and children and youth were meeting that kind of 2 times per week level of exposure to green spaces, suggesting that this might be playing somewhat of a role. So really what we're observing is this awareness action gap that we identified in the literature, where 92% of parents agree that playing in nature is good for their child's health, and yet 56% of children are sort of spending 2 hours or more per day with their electronic devices, and only 42% of them are visiting green spaces twice a week or more. So this awareness action gap is really where behavioral science fits really, really well, because it allows us to start to unpack, what are some of the barriers that are interfering with that are playing a role in this sort of awareness action gap. So thinking about those barriers, what we did was we got parents to kind of endorse various statements related to common barriers that we observed in the literature. And again, we did this disaggregation where we looked at parents of children who visited less than 2 times per week, and then parents of children who visited 2 times per week or more. And remember, that's kind of the threshold where we're seeing this sort of association with increased pro-social behavior. And what you'll see is that for all categories of barriers, parents of children who are visiting less than 2 times per week are endorsing statements related to these categories of barriers more often. And those categories of barriers include scheduling and planning, barriers to engagement. So, not knowing what types of activities to do with a child or youth in green spaces, environmental factors such as a fear of insects such as ticks, safety concerns, skills and resources like pitching a tent, for instance, location and transportation, and then allergies. Now, we wanted to think about kind of the effects of various child and youth related variables as they relate to the barriers that parents kind of endorse. And across the board, you'll see some differences. So for instance, parents of youth, a higher proportion of them endorse statements related to barriers to engagement, right? So maybe harder to engage youth while in green spaces, whereas parents of children between the ages of 3 and 11 were endorsing barriers more so related to safety concerns, skills and resources, location and transportation. But what I thought was really interesting in the data was if we look at parents of children with a disability versus those with children who don't have a disability, that they don't identify as having a disability, you'll see that parents of children with a disability, a greater proportion of them are endorsing every single one of the categories of barriers. And the differences are quite large. So, if we think about scheduling and planning, 89% of parents of children with a disability endorse that this is that statements related to scheduling and planning, versus 50% of parents who did not report that their child has a disability. And this kind of starts to build a bit of a picture. You'll remember that children and youth with a disability, a smaller proportion of them were accessing green spaces twice a week or more. So we're starting to see that these barriers are likely playing a role. We also looked at the amount of time that children and youth took to get to the nearest green space that they regularly visited during the warmer months. And what we did was, again, disaggregated the data, looked at parents of children who went less than 2 times per week versus 2 times or more. And you'll notice that a smaller percentage of those children who were visiting less than 2 times per week took less than 15 minutes to get to the nearest green space, whereas 65% of those children who visited kind of 2 times a week or more took 15 minutes or less to get to the nearest green space, suggesting that really kind of distance to the nearest green space or sort of transportation-related barriers. Interestingly, a much smaller proportion of children and youth with a disability versus those without a disability spent less than 15 minutes getting to the closest green space that they visited. Now, thinking about the method of transportation, again, disaggregating the data, you'll see that children and youth who visited less than 2 times per week, a smaller proportion of them used active transportation, so walking or being carried in a stroller or biking or scootering or any of those related prompts. And that makes sense. It does seem as though they might be sort of further away from the nearest green space, which means that active transportation might be less possible. You'll also notice that only 4% of respondents in each of the 2 kind of categories, children visiting less than 2 times versus 2 times or more, reported using public transportation. So I was expecting kind of a higher percentage. What that says about sort of public transportation or maybe default behaviors and how we access kind of green spaces or the types of green spaces that we're accessing will have to be unpacked further, but definitely thought that was an interesting finding. So we then wanted to move on to think about enrollment in nature-based programs and identify maybe some of the barriers that might play a role in parents enrolling their children and youth in nature-based programs. So enrollment levels were 27% of parents reported that their children were enrolled in a nature-based program or a program with a substantial nature-based component during the warmer months, whereas only 21% reported that they were enrolled in the colder months of the year. Now, we identified 3 potential categories of barriers that might explain some of these sort of enrollment percentages. And hopefully, if we remove some of these barriers or address some of these barriers, we can work towards sort of increasing children and youth's access to nature through nature-based programming. So you remember that 92% of parents agreed that playing in nature is good for their child's health. So it doesn't seem as though it's that parents don't perceive the value of nature and exposing their children to nature. It's likely that other sort of barriers are playing a role. Another barrier might be that parents are just not aware of existing nature-based programs. And what we found was that 56% of parents reported that they were aware of nature-based programs located in their local community. Certainly, this percentage can be a readout of, programs exist and parents are just not aware of them, or programs don't exist and that's why they're not aware of them. But certainly awareness may play a role as well. And then finally, there might be other sorts of barriers that play a role here. And so what we did was we took parents who said, yeah, I'm aware of, nature-based programs in my local community. And then we asked, well, have they enrolled their child or youth in one of these nature-based programs? And you'll notice that 42% of parents who had reported that they were aware enrolled their children during the warmer months, and then 32% reported that they had enrolled their children during the cooler months. So certainly awareness is important, but it doesn't kind of bring us to the door of enrolling children in nature-based programs. Okay, so now thinking about all of these barriers that we've talked about, what are some strategies that might be employed for increasing children and youth's exposure to nature? So what we wanted to do was, in line with some of the work that's being done on park prescriptions, we want to ask parents, if one of the following professionals or organizations recommended that your child spend more time in nature, would you sort of follow through with that recommendation? And unsurprisingly, most parents would follow through with the recommendation of a healthcare provider, physician, a nurse, mental health providers. But what I was really excited about was seeing teachers, school counselors, extracurricular instructors, and coaches appearing up here as well. A lot of the conversation around park prescriptions is really around healthcare providers. So it's nice to sort of have this evidence that parents would kind of do agree that they would follow through with the recommendation from a teacher, school counselor, extracurricular instructor, etc. What I found a bit surprising here was that only 40% of parents endorsed that they would follow through with a recommendation from non-governmental or nonprofit organizations. And that was interesting since a lot of the work around promoting children's access to nature has been done by these organizations. And so what this might suggest is that partnering with, for instance, educators or mental health providers or other healthcare providers might kind of increase the endorsement of programs that are being run by, say, nonprofit organizations. Now, if we come back to the teacher, school counselor, extracurricular instructor piece here, we also ask parents whether or not their child's school curriculum has at least some time dedicated to engaging their children with nature. And 63% of parents reported that that is the case. And so what this does is it really highlights an opportunity to potentially work with schools and teachers to really meet parents and children where they're at, which is in schools, to kind of increase their exposure to green spaces, especially since parents are reporting that they'd follow through with the recommendation of these types of educators. You'll remember that I mentioned earlier that there might be sort of barriers to green space program enrollment that parents are facing, and that's why we're not seeing particularly high enrollment percentages. And so what we did was we presented participants with a list of sort of features of green space programs that would influence their likelihood of enrolling their child in one of these programs. And you'll see the usual suspects as what's been shown in the literature before: types of activities, ease of access from primary residents, level of risk to child safety, cost. Many of these features are being endorsed by parents and are probably on the minds of parents when they're enrolling their children. Now, I will say that 87% of parents with a child or youth who they identified as having a disability, of course, reported that a program being accessible to children with a disability was important to them, was an important feature that they were considering. Now, finally, if we think about child and youth engagement, that was one of the barriers that we identified in the literature. It was also a barrier that came up in our own results as well. And what you'll notice is when we think about sort of the proportion of children and youth who met that 2 times a week or more level of exposure to green spaces, parents who reported that their children were very engaged while in green spaces, a larger proportion of them met that kind of 2 times a week or more, compared to parents who are reporting that their children just weren't engaged while in green spaces. And now if we think about hours spent with electronic devices, so screen time, parents who reported that their children were very engaged while in green spaces, actually a smaller proportion of them were spending 2 hours or more per day with electronic devices during their free time. And so one potential strategy would be to hopefully increase child and youth engagement while in green spaces as a way to increase green time and potentially also decrease screen time. And I'll just say just one final piece about screen time. There are kind of like innovative apps that do get children outside and get them to interact with nature, almost as mini scientists. So I think that the screen time question is really more complex than we were able to unpack with our methods. But certainly follow-up research needs to be done, given that there might be this sort of intersection between using technology to get children outside. Okay, so I'll just end off with a summary and really some recommendations based off of the data that we generated. So you'll remember that we had 3 objectives. In order to save time for the question and answer period, maybe what I'll do is I'll just go through our key recommendations here. But the first recommendation is really to establish and communicate green time guidelines to parents, educators, healthcare providers, and policymakers, really making parents aware of kind of how important exposure to nature can be. Also identifying targeted strategies for increasing exposure for youth, girls, and also children and youth with a disability. And remembering that nature is for everyone. So focusing on closing the nature gap by ensuring that green spaces are equitably distributed across communities and really accessible to equity deserving groups. Now, if we think about our third objective, which was to identify the drivers and barriers underlying children and youth's exposure to nature, some of our recommendations are really to aim to increase parental connection to nature through programming that might even be designed to incorporate parents and children interacting with one another in green spaces, since parental connection to nature does seem to play a bit of a role as well. Identify strategies for reducing screen time and increasing green time, especially for youth and children and youth with a disability. That might be by reducing barriers or also increasing child and youth engagement. And finally, really thinking about closing that sort of awareness action gap by meeting parents, children, and youth where they're at, by integrating green spaces and nature-based programming into schools and local communities to make them more accessible. And then unpacking that kind of piece around the types of professionals that parents are willing to kind of listen to their advice, partnering with healthcare providers, educators, and schools to potentially increase children and youth's exposure to nature through park prescriptions, and even accessible nature-based programming might be an effective strategy. And then finally, really designing nature-based programs with barriers to access in mind, especially for children and youth with a disability, as we saw that was really important throughout our results. Okay, so I'd like to thank everybody for coming again today and paying attention to this presentation. I'm really excited about the findings. I hope that you enjoyed the talk, and I'm happy to answer any questions that you have now.
So I'll jump in with the questions that we've captured in the chat, and thanks everybody for contributing your questions. And thanks, Daniel, so much. That was incredibly interesting and I think so timely, and lots of cross-cutting themes that I think for a lot of us, we've got these questions. You're providing some answers, so thank you. So there is a question from Chris Kells. I think I'll just start with, because you were talking a lot about nature-based programs, and the question is, what would be what would be some examples of nature-based programs? Gardening programs would be potentially one example, but what might be others?
Yeah, so we left the prompt for parents kind of open. So the question was, was your child enrolled in any nature-based programs or programs with a substantial nature component, including those that are full-time or part-time? And then we have examples, which would be like eco camps, eco schools, nature-based after school programs, scouts, Girl Guides. The other day I was kind of looking around in my local community, and there was a forest-based school. I was super excited to see that, and probably would have wanted to attend that if I was a child still. But yeah, I think any type of program that's really connecting with nature. There's even been shown some work that has shown talking about green spaces and bringing plants into the classroom can have beneficial effects as well. So pretty large, broad umbrella for what could be considered a nature-based program.
Thanks. So the next few questions, a few people are actually curious if you could speak to what constitutes an experience in nature or recreational nature experiences. So would walking or riding to school count? And whether, say, even going out to your backyard where there are trees or gardens and lawns, whether that would count?
Yeah, I think that's a really great question, and that was a major question I had when working on the survey with all of our partners. A major question that we had to work through as well, and that was in part why we provided the kind of list of spaces so that we knew that all parents were responding, keeping kind of the same definition in mind. But my reading of the literature is really any type of kind of where children and youth can interact with nature, right? So, picking up a leaf and looking at it and looking at some of the differences there, interacting with some of the insects that they come across, all of those things that involve this kind of active engagement in nature is really important. But even just gardening with a child, I've seen in the literature as well. So just that kind of active engagement, I think, piece is important.
Perfect. And Alice is asking about infants and earlier, so before age 3. Was data collected or comments made by study participants about exposing their infants to green spaces or the value of getting fresh air for our young ones?
Yeah, that's a really great question. So the strengths and difficulties questionnaire that we used has sort of a cutoff for the population that it's validated in, the parent-reported version. So we actually set a criteria for participating in the study that their child that they were reporting on was between the ages of 3 and 16 years old. So we unfortunately didn't collect data on the earlier years, but that's certainly an interesting question.
Yeah. I remember back, like the grandmothers that would leave their stroller. I mean, now they're grandmothers, but that generation where, you're encouraged to leave your strollers out with your baby, like that would, that would have been an interesting, I think, group of people to speak with. So also there is a question from Chris Kells. What is a park prescription, which appeared on your last slide?
Oh, yes. Thank you for asking about this because I'm obsessed with park prescriptions. So I can drop or we can send the link afterwards potentially, but I know of at least one physician in BC that works on park prescriptions with other types of healthcare providers across Canada. And at least their model is that they're able to kind of prescribe a park pass to make accessing national parks more accessible. So that's kind of what I've seen come up, at least in the park prescription space actively. But then in the research space, it's really just a recommendation from a physician to spend more time in nature.
Thanks for clarifying that. Julia is asking, what is the role of the municipalities in creating more spaces and even encouraging their citizens to get out to the green spaces? Will they be receiving this data across Canada somehow? Julia is in Quebec, so the percentages are interesting and somewhat troubling.
Yeah, definitely. So unfortunately, I can't really speak to the municipal level. When we were thinking about access to green spaces, it really is a bit of a complex problem if we think about kind of levels of government. So our survey was really just tapping into general access in general, as opposed to looking at, for instance, accessing like a provincial park or a municipal park or a federal park. But certainly work needs to be done in that area. It just wasn't included in our study.
Okay, and Alice and Colleen from the Hub are both wondering if there's a connection to social prescribing. I'm wondering if that's related to the question about the park passes, perhaps, or maybe more broadly. Sorry, I'm not sure, Colleen and Alice, if I'm misinterpreting that, but is there a connection with social prescribing? That's the overall question.
I'm not too familiar with that space in particular, but I will say that some of the literature on children's access to nature and just kind of social interaction in general, going into green spaces with friends and accessing green spaces in that way can promote kind of positive social outcomes, which is probably indicated by the readout that we have here with pro-social behavior. But as I said, I'm less familiar with the kind of social prescription side of things.
Terrific. So those are our questions, and I think that's probably the time we set aside for questions. So I will turn it over to Alice.
Super. Thanks, Annetta. fielding all those questions. I could keep asking questions here if we had another half an hour. It's such interesting information that you're sharing, and I do see connections across various other types of information and studies, and I think it just enriches our knowledge about children and youth and what we can be doing to support them in accessing green space. So thank you so much for this study and for creating a Canadian baseline data for us. I think that that's a really helpful place to start to understand more what some of the barriers and facilitators might be to access nature. So thank you so much for this study, and good luck with sharing all the data in your various ways. That it will be very interesting to see where this information can take us. So I have a few upcoming items. One is today's webinar recording and the slide deck will be shared by email. If you're interested, Annetta will share the sign up link in the chat. We'll also be creating an event brief, and we'll share that through our Hub newsletter that will come out shortly. We also ask that you provide us some feedback through just a short questionnaire, a couple of questionnaires that will launch automatically when the webinar closes. We really value your feedback. It helps us create these webinars as well as future informational webinars for you. And talking about that, we're giving you some advance notice for our next webinar that will be held on November the 12th. And it's an open webinar. Everyone is welcome to attend that. And it's exploring the value of intergenerational work in youth engagement. Part of what we're learning is that the intergenerational connection is so important when engaging youth in various initiatives. So this webinar will be led by the Students' Commission of Canada, and they have fabulous expertise in youth engagement, and so they'll be our guest speakers for this one. The registration will open soon, so keep an eye on our website and our Hub newsletter that's coming out. So again, thank you so much to both Dr. Daniel Amida for sharing this information, and to Shannon Bradley Dexter for hosting this and making this connection for us from the Public Health Agency of Canada. And we thank everyone for attending today. And if you want more information about the KDE Hub, and we have lots of fabulous information on our website, and you can also follow us on Twitter or email us at any time. Here are the links on the screen. We value your input and your participation in our events. And thank you so much for attending today on behalf of the Hub, and wishing you all a great day. Take care.